Today, I'm dealing on frequently asked questions that I've been getting in the comment sections. And these questions come from people across the globe: Ghana, Nigeria, Ethiopia, even those that trained that are in the UK are also asking questions. And I may not be able to exhaust all the questions in one video. So that's why you are seeing I tagged these frequently asked questions for IMGs, that's International Medical Graduates. One, I will still go through the next set of questions in the second video so that I don't make the video too long for you. Now, welcome back to my channel. My name is Dr. Chigozie, and I know that if you've been here, you will be following what I've been saying about international medical graduates practicing in Canada. If you've not watched any of the videos on how to start and what it takes, you can go down, click on it. You will look for the one with step-by-step on how to apply, then how to practice in Manitoba. There are, I think, like 3 videos before this one I'm making, and how to also get waiver for IELTS. I think I've made that. So having said that, I'm going to dive into these questions. Remember that these questions I'm answering now, I just copied and pasted the questions that people are asking in the comment section so that you pay attention and learn. And if I answer your own question, you should be happy I'm answering it, because there are lots of questions. I don't even know if I missed anyone. Good to see you. If you've not subscribed, please subscribe. Put the notification button so that anytime I upload, you will get it, because I find it difficult to upload every week because of time constraint. But any video I'm uploading is valuable and is time bound, so you need to get it on time so that you'll be able to follow suit with what is happening and join the moving train. Now, the first question is, as a medical officer in Nigeria, so obviously this question is coming from someone in Nigeria. Please, can you elaborate more on CAMS match and how to start the process from Nigeria? Okay, if you don't know what CAMS is like the body that helps with matching for residency in Canada. So what it does is you submit all your documents in CAMS and they help you with the choices you made. They will now also match it with the choices available to the universities, and depending on the competition and how many people that applied, you may or you may not get matched that year. It's just like matching you for residency. And the person is saying, how can you start the process from Nigeria? You can start it from Nigeria by first going to Physicians Apply. I made a video on how you can go to Physicians Apply. Then put all your documents there for verification. When it has been verified by MCC, you can now apply to write MCC QE1 from Nigeria. It is written in Lagos State, Nigeria. And when you finish MCC QE1, you can now use it to apply. Even for some provinces in Canada, with just MCC QE1, you can come into practice in Canada. And that's, in fact, specifically British Columbia has waived MCC QE1 even for some doctors. So if you are actively practicing, you can do that. That's a PRA pathway. There is a video I made on that. But for this particular question on CAMS, that the person wants to do residency. So if you want to do residency, the first thing is to go and write the exam. No, verify your document with Physicians Apply, then write MCC QE1, then write NACOTS key, apply for your CAMS, and if you match, you can come and start your residency. So please, could you share more details on how one might secure sponsorship if going through the specialist pathway? You can get sponsorship if you have people that are willing to sponsor you, that any of the hospitals or provinces willing to sponsor you to come into the country and practice. But then you should have verified all your documents to show that you are really a specialist. And all these document verifications, they will now merge it to see if it's at par with what is obtainable in Canada. It is only when you have qualified that you can now have the opportunity to start looking for sponsorship. So you cannot be looking for sponsorship when you have not verified your documents. So your document has to be verified, authenticated, before you can start looking for pathways that can employ you. Because once your documents are valid and it has been verified, it will be easy to get sponsorship. Another question is, I would like to ask, if I'm interested in doing a master's in public health, when would be the best time to do it, considering the requirement for some of the pathways and also generally speaking? The public being a public health scientist or physician is not a requirement for any application. It's just that it gives you an upper hand. Like when somebody that doesn't have it is applying with you as a family physician, you are likely going to get in first, more than as in getting first before the person somehow, because it is related to health and is a continuing education aspect of your credential. But that's not a requirement. If you don't have masters in public health, it's not going to stop you from practicing if you are a licensed medical doctor in Canada. In your country, if you're a licensed medical doctor and you want to practice in Canada, you have to do the due diligence and follow the process based on the province you are going to, because each province have what is obtainable in them. So it's not one size fits all for all provinces. So whichever province you have in mind, you should be sure what is obtainable in that province and you follow suit with that is what is obtainable in that province. I hope I answered this person's question very well. But if you're the owner of this question and you think I didn't do justice to it, you can just ask me to explain more in the comment section and I will explain more. But then what is the best time to apply for a master's? I will always advise you that the best time to start any application is now. Because when you apply now and you are to come and resume in September, you should have time to plan your travel and everything. If you don't apply on time, you will find out that you'll be choked. And the truth is, I think it's only once that you can defer your admission. So you can see now the reason why it's important for you to apply on time. I hope I've answered that question. The next one is, I need a private session specific to my situation. Would you be able to provide this, and how could I reach out to you to arrange it? Okay. Yeah, this I already had a session with this person, but I brought this question because some people may also be asking how can they reach me. You look through my YouTube channel, you will see where I put out my email is there. Not just my email, the link, if you are in any of that country, outside African countries, how you can pay and have a session with me. And if you're in Africa, how you can also pay. There's a payment link to have a session with me. The problem with some people is that they send me email, sending their CV, sending everything, and say I should help them go through their CV, sort their CV, arrange it, and also send my own CV for them to work with. And you don't even consider the fact that I also have something doing, and taking time to arrange these videos and bring it to you also take my time, and you still want me to give you such amount of time free of charge. I am not able to do that. I'm sorry if that offends you, but that is the truth. I will not be able to do that. Imagine the thousands of doctors that send me email. If I keep doing that, it means I don't have a life to live, and then I will do it free. By the time I'm done doing it free, who now pays me? So that's for that. So if you want to reach me, that's how to reach me. Then for the MLP-IMG medical licensing program for international medical graduates pathway, does the 1 year postgraduate year, I think that's what this person means, PGY is postgraduate year criteria, mean residency experience in the host country or just regular experience as a medical officer who hasn't started the program? I don't know what this person's question is exactly, but with what I'm understanding, I think this person is asking if having a 1 year experience in their country is the same thing as starting residency. I don't know. Or is the same thing as having an experience to start practice in Canada. I'm going to state the criteria to do practice ready assessment. One is you should have at least 2 years postgraduate experience. In Nigeria, internship is not counted. So I want you to have this at the back of your mind. Internship is not counted. 2 years postgraduate. So in Nigeria, it will be post-internship. So postgraduate internship is not counted. So if you have graduated, so you give yourself like a minimum of 3 years for you to qualify for practice ready assessment pathway. But if you want to do the CAMS and residency matching, you can start immediately, write your exams, do your document verification, write your exams, and you can apply for CAMS. If you match, very good. But remember, there are criteria for you to match in CAM. You have to either be a permanent resident in Canada, or you have to be a citizen of Canada. Let that sink. So the next question is what? Please, can someone apply for MLP IMG from outside of Canada? This is province dependent. It depends on what the province wants for you to be able to do this. Medical licensure, some people can actually apply from outside of Canada. I know that in BC, you can apply. They verify you. If you qualify, they can give you sponsorship. You get a work permit, come in, and you can do that. So it depends on province, but some provinces are not as flexible as other provinces. So it depends on the province you want and what is obtainable in that province. I want us to be very clear about that. Then the next question is, see the question I'm on now. He said, I have done my MBBS from India. So this question is coming from someone in India. After that, I completed my 1-year internship and 15 months of resident medical officer. I think in India, resident medical officer should be the same thing like medical officer in Nigeria. Resident medical officer work in a private hospital. My query is, do I need postgraduate training? Okay, this person asked this question under the video I made on PRA, that's practice ready assessment. So the thing is this, for practice ready assessment pathway, you need a minimum of 2 years post internship. So your internship is not counted. So because it's a 2 years minimum, your 15 months is not up to 2 years. 2 years is 24 months. So my advice to you is to complete your 24 months and still continue working in that hospital you are working as a medical officer while you apply to British Columbia, because British Columbia have waived the exam. So if you apply, they verify your documents and everything, and they think, okay, this person is qualified and we can take this person, they will tell you the next step and what to do next. I am not in the position to tell you that because I am not one of the recruiters or someone that is working for British Columbia government or the medical council in British Columbia. So that's for that. But with the criteria and what they have currently, if you meet the criteria of doing your postings in the core departments that I mentioned in the previous videos, and also completing your 2 years postgraduate work, not post internship. I think I should be using post internship because some of us may think internship time is calculated. Internship is out of it. It's 2 years post internship time. If you complete it, you can apply for practice ready assessment. Then the next question is, how do you think NAC OSCE can be best done? Move to Canada and figure out how to do it there, or go for it and come back as you wait for response on the application? My advice would be this. This is my advice. If you can find your way genuinely, like the way to come into Canada genuinely, not as an illegal resident, as a legal resident of Canada, either through permanent residence, through work permit, any way you can come into Canada. I think it will be best to do that and come and write on NAC OSCE than saying you will get a visitor permit to come and write NAC OSCE, then you go back again, then you now wait until everything goes. But if you are in Canada, somehow you will also be working with your work permit while you wait for the result to come out, and it's easier for you to transition with your work permit into working in the healthcare sector if you have passed and you have any hospital or a province that wants you and are ready to employ you. They can easily sponsor you for the either practice ready assessment, or once you have NAC OSCE, you can actually go for residency depending on the department you want to go into. So I think that's for that, and I hope I answered this person's question very well. So if you leave me to say, I will say find your way into Canada legally and come and write NACOSKI. But if you don't have a way of coming into Canada and you have passed your MCCQ1 and is remaining NACOSKI, you can apply to British Columbia with your MCCQ1. See if they can give you sponsorship. When you come to Canada, you work for them, and if you still think you want to do NACOSKI and enter residency, you still have time to do that if that is what you want. I hope that helps. Then the next question is, I am in my 2-year post-graduation, currently doing my service. I think this question should be coming from someone in Nigeria, if I'm not mistaken. Do I qualify for PRA? Also, is TDM exam? For those that don't know what TDM is, TDM is therapeutic decision making exam used as the person is asking, is TDM exam used as a waiver for NAC in Manitoba? No, TDM is not used as a waiver for NACOSKI. It is not done. It is not that. That's not what happens in Manitoba, please. And you said you are 2-year post-graduation currently doing your service. You are not 2 years post-graduation with what they required. Your post-graduation is finishing university, but what they require is 2 years post-internship practice. That's your internship is not counted. 2 years post-internship practice. So if you have your NYSC and you have also worked for at least 1 year as a medical officer, you can qualify for your practice ready assessment, and you can do that from your home country. Apply to the provinces that accept that and the provinces that have waived MCCQ1, just like British Columbia. I did a video on that, so you can go and watch it and see how you can navigate that. Then, and I will also put the video, like it's going to come up before the end of this video. I'm going to put the video on British Columbia so that you can watch it and see what I'm saying about it. So the next question is this question. He said, I am an MO, medical officer. I just finished my house job in, the person called the university teaching hospital. This person is from Nigeria because this is Anambra State. Say, please, I need a one-on-one mentorship assistant on how to start this journey. Okay, your one-on-one mentorship assistant can be granted if you go through the link and make payment for my time. Then we can have a one-on-one chat. I will see where you are and see where I can support you from, and also review your CV and see what you can do to modify and start up your step. That's what I can do. But I want to clearly say I am not working with any of these people, and there is nothing extra I can do for you rather than just to guide you and make sure that you are having the correct information that I'm putting out here, because I do my due diligence before I bring out this information. Then, do we need IELTS? I have made a video on IELTS, and it will still pop up either down or below this video on this IELTS thing. IELTS is judged case by case. So I cannot tell you now IELTS will be waived for you when I don't know what your study is like or the country you are in. And the worst part is that I don't know who asked this question. I saw it and I copied it from the comment. So whoever asked this question, IELTS is judged case by case. There are countries they do not require IELTS for, and there are countries that you require IELTS. So whichever way or wherever you are coming from, it is case by case dependent. I think that helps. Then the next one is, if I'm a medical officer working as a general practitioner in my country, does that experience still count, or do I need to have residency experience that count only? No, it's not. Residency experience is not the only experience that count. As a medical officer, if you are working in all the departments, basic departments that you're supposed to work in, that was listed by the province of British Columbia, I listed all those in the video that I made. I can't be going through it again. If you have gone through those emergency medicine, psychiatry, internal medicine, surgery, like I listed all of them. If you have gone through them, what a family physician does most times is that's what a medical officer does, because jack of all trades. So that's the thing. If you have gone through that, you can also qualify for practice ready assessment pathway. So it does not mean that it's only those who have done residency that can qualify for practice ready assessment pathway. If you're practicing and you are doing exactly what a family physician is supposed to do, but in your country they call it a medical officer, you can apply. They will check everything that you have, your experiences and what you are doing, and see if you qualify for the practice ready assessment. If you qualify, then you take it up and they will take it up there, take it up from there for you. And I wish you success. So what's the next question? The next question is, what about specialists general medicine? Do they need to write the exam? Yes, you need to write exam. If you want to be a specialist, you do document verification first, write your exams, do CAMS match, then you can match into the department you want, if it's general medicine or if it's internal medicine. But if this your specialist general medicine means family physician, then yes, you can do practice ready assessment pathway. I do not know the country where this question is coming from, so I don't know what general medicine means for your country. If a general specialist general medicine means family physician, or it is the part of medicine that you do everything, I think that's the same thing as a family physician, then it means you qualify for practice ready assessment. But I am not the one that will say exactly if you are 100% qualified. You need to do document verification. I provided the link on how you can reach out to British Columbia also. Then you go through that and let them verify your document and see if you qualify. But then before you can do all these things, remember your documents should have been verified by the Medical Council of Canada via Physicians Apply. So if you've not done document verification in Physicians Apply, you can't even move to the next step. So that's the first thing you should do. As at now, go and verify your document. If you have interest in Canada, that's the first thing you should do. Then the next question is, can I use WES for evaluation if I am not the primary applicant instead of the MCC? It is taking so long to be verified. I don't know why this person is asking this question. But if you are not a primary applicant, what business do you have with MCC? But if you are talking about PR, applying for permanent residency, even if you are applying for permanent residency, what you are supposed to do is you still verify your document via Physicians Apply. You are not using WES as a doctor. So if you're a medical doctor, you're a physician, even if you are applying for PR, that's a permanent residency to Canada, what you need is what? Physicians Apply verification, not WES evaluation. So when they do that, that's what you will submit for your permanent residency application. I think that's what this person is asking. But if not, if you see this and you think I've not answered your question, please clarify your question very well. And the fact that it's taking so long to be verified is the reason you should wear a cloak of patience when you are making these applications, because they have lots of applications coming in, and the truth is on first come first serve. So they're going to verify those that came before you before it gets to your own turn, and you have to give those doing the verification what you have to give them grace, because they are human beings as well like you. So having said this, I think we have come to the end of this first session, so that the video will not be too long. If there is any other question you want to ask, please put it in the comment section. I will still go through it and come and answer all the questions. Having said this, please, have you subscribed? Please subscribe, share, like, and invite your friends to my channel. I'm looking at having a day where I can come live and I will have a chat with all of you that may have questions. If you think that's something you'll be interested in, say I'm interested in the comment, and I will look forward to the day I can make that plan and also bring someone who had gone through practice ready also to come and join us in answering your questions. Do have a nice day, and thank you for being around my channel.